Due to biological, psychological, sociocultural, and economic factors, young people, particularly those aged 15 to 24 years, are generally at high risk of HIV and AIDS and other reproductive health problems. Hello and welcome to this episode of The Last Mile with NACA. I am Adesu Alsui. This episode zeroes in on out-of-school youth and examines factors that predisposes them to HIV-related risk behaviors that might lead to HIV infection. You're watching The Last Mile with NACA. Don't go away.
About 258 million children and youth are out of school, according to data by the UNESCO Institute for Statistics for the school year ending in 2018. The total includes 59 million children of primary school age, 62 million of lower secondary school age, and 138 million of upper secondary age.
Young people out of school can be defined from different perspectives, and Nigeria is one of those countries that has very high proportions of children out of school, and there are different classifications which has to do with those that never went into school. That's one classification, and there are those that started but did not complete. So those are the different definitions for out of school from the education sector. For a broader programming definition, it's about looking at what your school does to young people, the protective cover it provides, and also the opportunity for information and exposure that it covers. So and it extends from 0 to the age of around 24, because those are their very viable years. Those are the years, especially the adolescent age, I would say, which is 10 to 19. Those are very critical periods for young people, and being out of school at that point, especially for girls, has a lot of their complications.
Studies have shown that this demography are more predisposed to HIV infections due to many factors, including risky sexual behaviors.
Studies have shown that young people out of school are more vulnerable than those that are in school, more vulnerable to abuse, more vulnerable to infections and different health conditions, health-seeking behavior, and skills on how to resist peer pressure, and even how to get information, how to communicate, the issues of stress management, and all that. So if young people do not go through school, then they miss out on all that. But also because in the future, they are going to have less economic power, social economic power. They're not able to develop into a good earning situation, especially for the girls. So they will have to be dependent. They don't have bargaining power. So there's power imbalance. They are exposed to sexual violence, gender-based violence, because they are disenfranchised because they did not go to school. So all that accumulates to increase the vulnerability of young people that are out of school.
Ezine Uchendu, an assistant director in the Community Prevention and Care Services Department of NACA, speaks on some of the challenges with regards HIV programming for the group.
The mandate of the Community Prevention and Care Services Department is to ensure that HIV prevention interventions are carried out in the different communities, ensure that people who are on treatment have access to their drugs, and also lead the non-health sector interventions of HIV prevention. The department covers 3 different divisions. We have the Community Prevention Division, which is in charge of community prevention interventions as a whole. Then we also have the Health Sector Division, and then the Gender and Human Rights Division. New HIV infection is high among out-of-school youth because of different practices that they involve in. A lot of out-of-school youth abuse drugs, which also affects their decision making. When people abuse drugs, they will not be able to engage in prevention interventions that will also make them not contract HIV. Some of the out-of-school youths that are also infected with HIV, when they abuse drugs, they may not remember to take their drugs, they may not adhere to their drug regimen. A lot of adolescents and young people are also key population community members. When we talk about key population community members, we are referring to sex workers, people who inject drugs, men who have sex with men, people in closed settings, people in custodial settings, and also transgender community. So because a lot of them are also key population community members, some of the practices that they engage in expose them to HIV infection as well.
Besides the profound impact on the health systems of a nation, the prevalence of out-of-school youths also have economic implications.
HIV prevention is a curriculum, it's a co-curriculum module that the federal government of Nigeria has in its education curriculum. So everybody that goes through primary school, from upper primary school to secondary school, you have some basic information about HIV prevention, what to do about it, what not to do, life skills, how to say no to premarital sex, how to abstain, the ABCs, have those basic information, which is like the foundation. So if you have young people that have not gone through school, and then they also don't have access to that information out of school, then they grow into a population of adults that are unlearned, unskilled, and probably HIV positive. So they are a liability to themselves, a liability to the economy, and the health system, who have a sheer number of people that are practicing behaviors. Because they practice behaviors in their youthful age, they've now come into the future adult with hypertension, diabetes, HIV, and all sorts of things. And so the burden of infection, of disease, public health system is overwhelmed, and the country is not able to invest enough money to take care of those group of people. It becomes a social risk.
NACA collaborates with relevant stakeholders on various programs for adolescents and young people, including out-of-school youths.
Okay, NACA has the mandate of coordinating all HIV program in Nigeria, but NACA does not do this alone. NACA works with different partners, different stakeholders, donor agencies, to ensure that these interventions are carried out in different places. For interventions targeting adolescents and young people, that's where we have the out-of-school youths as well. A lot of interventions are being supported by partners. The UN system, Global Fund, is also supporting interventions targeting adolescents and young people, that's out-of-school youth. And some other partners are doing great work in Nigeria to ensure that all out-of-school youths, in-school youths are reached with prevention interventions, and also ensure that even the ones that are infected already have access to HIV treatment. We have youth-friendly centers where they receive their interventions.
UNICEF has been working with NACA to support in building the systems that will support young people generally, whether in school or out of school. And one of the ways we have done that is working with young people themselves. We have a technical working group where there's a subgroup that addresses the issues of young people and develop programs both at the national and state level to ensure that the specific issues of young people in terms of communication, service delivery, and retention in care for those that are HIV positive, the system is responsive to it. Another area we have worked on is something we call adolescent kits for expression and innovation. So that is a package of tools and materials and supplies that we use to train young people, adolescents basically, in communities with life skills and competencies that will help them to be able to participate maximally and also to influence their peers, have the right behaviors, and also give back to the society. And people might think, what does that have to do with HIV? It has everything to do with HIV because when young people are empowered, especially the girls, and they have agency, they have a voice, they are less exposed to risk. And so because it's all about risk and vulnerabilities, that is what increases the HIV, the new infections in young people.
At the state level, we have the state agencies for the control of AIDS. They are also supporting activities at the state level. And different partners are also programming in different states in Nigeria. So all the states have programs ongoing targeting adolescents and young people, and also the out-of-school youth.
There is a need to strengthen comprehensive sexual health education and youth-friendly HIV prevention strategies to promote abstinence and safe sexual behaviors.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
This HIV test kit na ogbonge test kit wey WHO, Federal Ministry of Health and NACA don confirm. If you go like know more about the test kit, make you call NACA Information Center on top 6222 free of charge. Make you no eat, drink or use anything where they take clean mouth 30 minutes before the test. Or yeah, make you look for somewhere where be say na only you go dey there, we get better light and flat top. When you open the test kit, you go see paper wey explain how you go take do the test. Read am well so that you go fit understand them. You go still see test stand and another package where be say e get test device, plus including test tube and something where be say them put am so that the package no go spoil, but you no go need that one for the test. Or yeah, open the tube, then put am on top the test stand. Now make you carry the test device, but make sure say you no touch the flat side. Or yeah, open your mouth, then rub the flat side of the test device one time on top your gum wey dey up and one time for the gum wey dey down. Now quick make you put the device inside the tube. Leave am there for 20 minutes before you read the result. Make you no read the result after 40 minutes. Now, if one line show on top letter C and letter T, then the test na positive and you go need to contact NACA for advice on wetin to do next. If only one line show on top letter C, then the test na negative. The test no follow at all if no line show or only one line show on top letter T or the background will be white before come change to red. You go need to do the test again. When you finish, pack everything where you take do the test, put for inside dustbin. Make we support NACA to fight HIV. Know your HIV status today.
It is apparent that all hands need to come on deck to deal with identified predisposing factors and to address the problem of idleness. Our update segment is next. Keep watching.
The National Agency for the Control of AIDS, NACA, and relevant stakeholders recently held a workshop to update and review the non-health sector tools for HIV programming in Nigeria. The Strategic Information Officer in the Monitoring and Evaluation Department of NACA, Dr. Uduakesien, explains the purpose of the workshop.
The workshop going on behind me is the non-health sector tool review workshop that is happening now. You can see many groups working, focusing on different thematic areas. And we want to say thank you to Global Fund for funding this. We didn't do this alone. Global Fund funded this and we're grateful for that support. The non-health sector had been dormant a while because the previous tools had been outmoded, no longer what we should use now because of the changing dynamics in the HIV response and also the newer things coming on board. So this had to be reviewed to capture those dynamics, to be able to report granular data if we want to end this epidemic. The health sector response to is good and running, but the non-health sector has not been all that okay. So we are updating this to reviewing this to show that we're able to capture data in its granular form in order to end the epidemics, to be able to plan intervention. And also this, what are we capturing in this tool? We're looking at the community care and support tool, which addresses gender-based violence, which addresses vulnerable children, not orphans and vulnerable. It's not called vulnerable children. It also addresses the legal aspect of it and home-based care as well in the community level. So we get this data and then we're getting it holistic. So we're getting the health sector data coupled with the non-health sector data. We will not be able to plan as a country and also be able to plan intervention for this area of focus. So we also look at the FLHE, the Family Life and Health Education is also covered under the non-health sector. And that also means our schools, our children are also taught these things. We also look at schools, the teachers and the principal, the heads. So all these are covered. So we get all this information from the grassroots around the country. So this tool is going to address all of that. Also would address the HIV prevention and treatment, the non-health sector, the general population, the key population, and all of that. So everything is holistic. So we're getting this data to be able to plan intervention, to also end the epidemic in the non-health sector.
While commending NACA for the initiative, some participants also shared their thoughts.
The workshop is basically a continuation of what we have been doing for the past weeks now. Over 6 weeks, we've been working on developing the community tools, a platform where we'll be able to report our community intervention. Like right now, I work with a network of people living with HIV and AIDS in Nigeria who are the recipient of care. A lot is still going on, especially at this last mile of trying to end the HIV epidemic. So we need all the data we can get, both from the hospital setting and then the non-health hospital sector. That's the reason why we're here.
The revision of the non-health sector tools will go a long way in aiding Nigeria fulfill its global reporting obligation on the non-health sector indicators.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. What you dey find? You go see am o.
No be so, my sister. Eh? HIV test no be bad thing. Now make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin.
Yes, so during pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef. He go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait oh, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
UNICEF presents that globally, at least 300,000 children were newly infected with HIV in 2020. Now, of this alarming figure, Nigeria was responsible for 20,695 cases. This indicates a need for a much more strategic approach to prevent further decline in the nation's HIV infection rate.
About 300,000 children born HIV positive. Over 20,000 of them were born in Nigeria. This is a crisis of immense proportions, and it can potentially erode all the good work we've done over the last 2 decades.
The taps in the general population and key affected population are now running slowly. However, that of mother-to-child transmission is the one that is still running fast. And this means this year, 2022, we're going to look at expanding our services to include every pregnant woman and get them tested and make sure that every HIV positive pregnancy is prevented from transmitting that disease to the newborn.
The HIV Trust Fund is timely and will be critical in helping us address the gaps in acquiring test kits, laboratory reagents, and drugs for pregnant women over the next 5 years. We are excited about the private sector commitment to this cause and wish to thank them in advance for their engagement.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesu. I'll see you. Goodbye.